Fellow Dominicans, from March 2020, Dominica has been dealing with the impact of the COVID-19 pandemic, which has significantly affected our way of life and livelihoods. Over the past 2 years, we have gone through various phases of the pandemic, and we have had to respond to periods of surges, new variants, hospitalization, and deaths. Throughout these challenging periods, our government has capably responded and provided quality health care for treatment of COVID-19, increased accessibility to COVID-19 testing, made safe and effective vaccines available to all, and put public health measures and protocols in place for the health and safety of the general public. Our public education drive, protocols and restrictions, progress in vaccination of our population, along with a less virulent strain of the virus, has significantly lowered our rate of hospitalization and deaths. Additionally, the number of daily new cases has dropped significantly in the last few weeks, and the positivity rate is trending downwards. Since the surge of cases in July 2021, government continually assessed the situation and has gradually relaxed restrictions to help the population transition safely back to normalcy. We successfully hosted pilot vaccinated entertainment events during the carnival season, and students have returned to face-to-face learning using a blended approach, and our COVID-19 cases continue to trend downwards. Around the world, we have noted the relaxation of restrictions as vaccination rates increase and healthcare systems are better able to manage the virus at this stage. It is within this context that Cabinet has approved a revision of COVID-19 protocols and relaxation of restrictions to allow businesses and activities to return to normal operations while protecting public health and limiting the resurgence of COVID-19 cases. Cabinet has approved the following changes to the Environmental Health Services COVID-19 regulations to take effect from April 4, 2022. Restrictions on religious gatherings have been removed. Churches are no longer restricted to a maximum attendance of 150 and may operate at full capacity. Public transportation is allowed to operate at full capacity. Restrictions on educational instruction has been removed. Daycares and preschools will be allowed to reopen in keeping with public health protocols developed for these establishments with effect from April 4th. Primary and secondary schools will return to full face-to-face learning for the third term on April 25th. All other educational institutions will resume normal operations in keeping with their academic schedules. All bars are allowed to resume normal operations. Restrictions on music and congregating have been removed. Nightclubs are allowed to reopen for under 300 patrons with strict adherence to health protocols. Restrictions on social activity, such as private parties and sporting activities with fewer than 300 in attendance, have been removed. For special events of above 300 patrons, a special event permit is required. Proof of vaccination or negative antigen test result within 24 hours of entry is required, and other health protocols will be applied. Sporting events with above 300 patrons will be hosted under the revised special event protocols. Nightclubs hosting events for over 300 patrons must also comply with the special events protocols. Physical distancing of 6 feet is no longer mandatory at businesses and establishments. Restrictions on visitation to the prison, hospitals, and home for the elderly have been removed. The public should note that these institutions will formulate internal policies for visitation in keeping with health protocols, and these policies should be strictly adhered to. The mask mandate remains in effect and will be reviewed in May. The removal of the mask mandate will depend on an increase in vaccination numbers and further reduction in COVID-19 cases, so we are all urged to continue following the protocols. All businesses, establishments, churches, schools, and forms of public transportation are required to conform to the safety protocols, such as sanitizing and the wearing of masks. In addition to the relaxation of restrictions imposed under the Environmental Health Services regulations, changes have been made to travel protocols to further ease travel to Dominica and support the full reopening of the tourism sector. For the cruise sector, all vaccinated passengers will be allowed to disembark and tour freely in keeping with the established cruise ship and port protocols. Cruise sector workers, such as taxi drivers, vendors, tour guides, must be vaccinated or present a negative 48-hour antigen test result and safe in nature pass. The requirement for pre-arrival testing and testing on arrival for vaccinated travelers at all ports of entry, to include seafarers and yachties, has been removed. Pre-arrival testing and testing on arrival will remain in place for unvaccinated travelers at the traveler's cost. Unvaccinated travelers who test negative on arrival will no longer be required to quarantine. Testing on arrival for symptomatic travelers will remain in effect. Travelers who test positive will be isolated in keeping with the local isolation protocols. Children 12 years and under will assume the status of parents or guardians. Travelers will no longer be required to fill and submit the pre-travel form online. While we are pleased to announce these changes and look forward to the positive impact on the economy and our livelihoods, I wish to urge the public to remain cautious. This announcement by no way means that COVID-19 is no longer with us. This is now the era of personal responsibility, and I encourage everyone to continue to adhere to all safety measures to protect against the transmission of COVID-19. Continue to wear your mask, wash and sanitize your hands, follow proper respiratory etiquette, and most importantly, get vaccinated to protect your health and help stop the spread of the virus. May God bless you. May God bless Dominica. I thank you.